Well, I think one of the most important things we discussed today is that issues in healthcare and issues in people's lives are profoundly linked with other conditions in their lives. If you don't have quality housing, if you don't have access to good food, if you don't have the resources you need, then there are great inequalities in our healthcare system. So what people said today was they wanted to clearly make the connection between what is an increasing inequality in our society and threats to the health of communities as a whole. I'll give you just an example. We talked about it a little while ago. For me, as a personal example, I have insulin-dependent diabetes. And if you're in my position and you have a job as I do, which is a good job and paying well, you can do very well in managing your own health care. But if you don't have those resources, if you are on income assistance or if you're on a minimum wage job, your ability to get the food you need to balance your insulin is very difficult. So we made some of those links between what we call the social determinants of health, things such as housing and income and community involvement, the links between those and the need to improve public health in BC.
So what is something specific that you as an MLA can do about it?
Well, one of the first things we're doing is the first things we're doing right now, because I'm an opposition MLA, is fighting the government's efforts to privatize healthcare in BC. So we've been raising those issues, we've been shining a light, because what the government has tried to do, what the Premier's tried to do, is make many of these changes in secret. Secret deals, we saw it at St. Paul's Hospital where they used the publicly paid for MRI. They handed it over for private use and allowed people to jump the queue and to get preferential treatment for money. We exposed that, and that practice has stopped. The case of the Falls Creek Surgical Center, which appears to be opening a private emergency room, we have been taking that issue on, and we are fighting those efforts as an opposition to ensure that the government is held accountable, first of all, but their hidden agenda, I think, to weaken public health care is exposed.
One of the questions in our calendar, VCTA 2007, as a matter of fact, the first question and the first page, if you open, is about public health care.
Yes.
And we have been asking people about it, and they say that health care should be paid 100% by federal and provincial taxes. Do you think that's a possibility, or is it just a dream?
Well, I don't know if it's a dream, but I think it's not. I think it depends. And one of the things we discussed today is what we mean by health care. I think one of the important questions about health and people's health and the social determinants of health is that how your health outcomes end up in life, how you do in life, depends on a whole bunch of things. So it's not just health care money. It's money for education. It's money for income assistance. It's other issues that are important. We in Canada have what we call a universal single-payer program for what's defined as medically necessary health care. And I think most people believe that should be public and supported by tax dollars.
100% paid by tax dollars?
Well, for what we call insured services, that's our single-payer system in Canada, which says that for services that are defined in the Canada Health Act as medically necessary, then those services are covered by, in British Columbia, by the Medical Services Plan. Now, not everything we spend on health should be covered by government. For example, some people want to do things that are beyond what would be defined as medically necessary. Some people want to have plastic surgery for appearance sake, which is not medically driven. Clearly, government isn't going to pay for that. But for medically necessary care, we think that a public insurance scheme should cover those things, and that system works very well. And it's also the most efficient system. If you have a whole bunch of parallel private insurance schemes or parallel private payments, you're going to spend a lot more money on administrators and accountants and the administration of healthcare. In the United States, 14 cents out of every healthcare dollar, 14 cents out of every dollar they spend on healthcare in the United States is for administration. In Canada, in our public plans, only 2 cents is paid on administration. So it's not just a social justice question. What single payer, what universal healthcare in Canada offers is a combination of administrative efficiency and social justice, and that makes it just an outstanding, I think, public service and public program.
Okay, so regardless of, depending on the definition of what healthcare includes, what you're saying is that it should be paid by 100% by.
That's right.
And the simple question
what
here.
What you have is a public health care system in Canada and what we define as medically necessary in Canada is covered and should be covered by our public health care system, and that's what we're saying.
So you would vote here in this poll as 73% of the people have voted that it should be paid 100% by provincial and...
I think a majority of people believe in Canada, a majority of people believe in our public health care system, that when you go to have something that's medically necessary, and we're not talking about some issues which are health choices, we're talking about medically necessary services. If you break your leg and need that leg to be treated, that it should be done in the public health care system, and it should be paid for 100% by public resources.
Mm-hmm. The fact that we could or could not afford, depending on the budget, is not a factor to you?
But I think every jurisdiction in the world has to deal with affordability. It's always been the case in Canada. It was the case.
Can we afford to have 100% paid health care by the government?
Well, the question is, because people make that ask that question and they pretend there isn't cost to not having health protection, right? And I think there are profound costs when we shift costs from taxpayers to the sick. Because remember, this is health care. This is essential to our lives. So somebody's going to pay. And either those things are covered by a public system that's efficient and dynamic and works, or alternatively, we're going to have to pick up the tab ourselves. And that means there's going to be two-tier health care. So when people ask, can we afford it? Of course we can afford it. Most countries, most Western democracies and some other countries in the world offer universal public health care programs. Most of them differ in some ways, in some small ways, but they succeed in delivering public health care. And we have in Canada for a long time. And yes, there are costs and increasing costs today. People talk about technology and everything else. But you think of the last 30 years and the changes in healthcare. There have always been challenges for our healthcare system. This is nothing new. But what's changed is we have governments who do not believe in public health care, such as the Campbell government. And that's what's changed. And people, and I think it's the majority of people who believe in public health care in BC, need to speak out against what the Premier's planning, which are cuts and privatization.
All right.